Type 2 diabetes and the clinically normal pulp. In vitro study by Sheikh Alsamahi and her group from Otago University in New Zealand. The aim of this study was to evaluate the effect of type 2 diabetes on the morphology of the pulp and on the expression of certain proteins that are associated with the immune system. For the material and method for this study, the model was used molars that extracted from type 2 diabetic patient, and the inclusion criteria were as follow. The tooth must be diagnosed as normal pulp, and the patient must have type 2 diabetes diagnosed 12 months at least, and he must be controlled as well. The age were limited from 30 to 55, and the aim for that is to eliminate or reduce the variables. Also, the HbA1c must be from 6.7 to 7.2. For each group, they included 10 extracted molars. For the histological staining, or before the sample preparation, we have the specimen were cut from below the semen to enamel junction, and then it was decalcified. The section thickness was 4 micromillimeter. For histological staining, they used H&E, and also they used special stains called Mason trichrome, and the other one was Van Jason stains. They used to identify the presence or for the collagen, connective tissue, blood vessels within the sample. The other method of evaluation was immunohistochemistry, which was used to evaluate the expression of the proteins. For the results, the first evaluation, the pulp for non-diabetic patients were pink, soft in consistency, and it was resilient. However, for a type 2 diabetic patient, it was much more harder and friable. Also, what they noticed on the H&E staining slides is that the cellular component of the pulp were much more less in type 2 diabetic patients when compared to non-type 2 diabetic patients. Also, there is changes in the predentin for the type 2 diabetic patients and more calcified tissue, and also TD, which indicates tertiary dentine-like structures were present in the type 2 diabetic patient pulp. If we go and see the D slide, it indicates that there is some discontinuity if we notice on the odontoblast layer, and also the orientation when we compare it to the non-type 2 diabetic normal pulp, it is slightly different. For the special staining, Mason trichrome, we can see for the type 2 diabetic patients, the connective tissue are much more dense, and the blood vessels are more thickened. And also it confirmed the finding for H&E that indicates less cellular components of the type 2 diabetic patient. For immunohistochemistry, it indicates that there are increase in certain chemical mediators such as interleukin 1 beta, interleukin 6, interleukin 17, and tumor necrosis factor alpha. Also, toll-like receptors were upgraded significantly for type 2 diabetic patients. So what we can take from this study is whenever we encounter a patient with a systemic disease, type 2 diabetic patient to be specific, treatment modalities might be altered for such patients, and we must take that into our consideration. For example, if patient presented for vital bulb therapy, we always keep in mind the changes that happen to the pulp, which may actually lead to different results when we compare them to healthy patients.